Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Ahmed Fool. I am the head of Geriatrics Unit in Rashid Hospital, Department of Health in Dubai. In this video, I'm going to talk about osteoporosis. Osteoporosis is a disease of the bone, and it means that your bone becomes thin in dimension, in diameter, and in structure. I will not go into scientific details of how it is thin and what is the structure, but it will become light and thin. Osteoporosis is a silent disease because when osteoporosis starts to happen from the age after 30 till the elderly age, till the old age, there is no symptoms, there is no pain, there is nothing. All of a sudden, at a certain age, 70s, 80s, a fracture happened. And the fracture at that time is the only symptom of osteoporosis. So you need to diagnose osteoporosis early and treat it before the fracture happens. I would like to take the chance of talking about osteoporosis to talk about another illness or another disease of the bone which is common also, and sometimes it is associated with osteoporosis and sometimes not associated with osteoporosis. It's called osteomalacia. And osteoporosis means that in order to understand the structure of the bone, it is like the blocks of building a wall. If you take some of these blocks from the wall become weak, so that you can, if you push it, it will fall easily. So this is osteoporosis. But osteomalacia means that I will not touch the bone, the blocks in the wall. I will not remove any block from the wall. I will keep all the blocks as they are. But I will remove only the minerals from the blocks. All the blocks are there, but I'm going to remove the calcium only from the blocks. So the bone at this state becomes bendable, easy to bend, like rickets in the children. And also it can fracture. But the problem with osteomalacia, which differs from osteoporosis, is not only with bone. It's with muscles, because most of the causes of osteomalacia is vitamin D deficiency. And vitamin D deficiency affects the bone and in the same time affects the muscles and affects the nerve transmission, the nerve electricity transmission, or the transmission of electricity from nerve to muscle. So the muscles become weak. And if you see a patient with severe vitamin D deficiency and osteomalacia, you will find them unable to stand from a sitting position and probably are unable to roll in bed from side to side and unable to stand up from sitting position except with support. So the osteomalacia affects the nerve conduction, so the electricity will not go easily to the muscle. And the hand grip will become weak. The muscle strength will become weak. The patient become unable to walk. So this is the problem with osteomalacia. Osteoporosis does not do the same. Because as I mentioned, osteoporosis, you are removing whole blocks from the wall, leaving some blocks and removing some blocks. So the whole wall become weak. But in osteomalacia, all blocks are there, but I'm removing only the calcium. But as I said, it's not the problem of the bone. It's the problem with the muscle and electric conduction from nerve to the muscle. In our country here, in the sunny countries like in Dubai and in the United Arab Emirates and the Gulf generally, people hide from the sun and wear dark clothes. So their skin is not exposed to the sun. So the vitamin D is not manufactured. Vitamin D is made by the skin by the effect of sunlight. And if you hide from sunlight, definitely you will be deficient of vitamin D. Vitamin D deficiency also causes muscle pain. So in addition to muscle weakness, the patient will have muscle pain. Pain in the shoulders, pain in the back, pain in the buttocks, pain in the thigh, pain in the legs, pain in the toes, pain in the... So pain everywhere is one of the symptoms of vitamin D deficiency. When it is mild deficiency or moderate deficiency, when it becomes severe deficiency, it starts to affect the muscles in the form of weakness. Now, I need to speak about who is going to develop osteoporosis. There are some criteria or some risk factors that make the person prone to osteoporosis. Like menopause, when lady go into the age of menopause, she loses her estrogen hormone from the ovaries, and this is one of the significant reasons why women after the age of menopause develop osteoporosis. Alcohol, drinking, smoking, and some use of steroids, some diseases like rheumatoid arthritis. The age in itself is a big risk factor for development of osteoporosis. So 30 years old person is different from 70 years old person. Age is an important factor for development of osteoporosis. How we diagnose osteoporosis? We can simply diagnose it by X-ray. But if the X-ray shows that the bone is thin, this means that you have very bad degree of osteoporosis. So we need to diagnose osteoporosis in a more earlier stage to give the patient appropriate treatment very early before the bone become very weak. We have here, there is one machine called DEXA machine. This machine can diagnose osteoporosis accurately. But the problem with DEXA machine is, if we're going to test all patients above the age of 50, so we are going to test very, very big number, huge number of population, and this is not cost effective. Because if we test everybody above the age of 50 and we discovered all osteoporotic patients, we will pay a huge amount of money and the outcome will not equal this huge amount of money. So the scientists start to think about a way to diagnose osteoporosis in a more economically better way or cost-effective way. They created a program that, in this program, you put your age, your sex, your alcoholist, if you drink alcohol or not, if you're on steroids or not, if you're a smoker or not, if you have any of the diseases that are mentioned in this program. And then you put your age and tick on a button. It will give you the probability of your fracture in the next 10 years. So putting these variables in a program and getting the probability of the fracture in 10 years, you will take this result and put it in a graph against age. So if the probability of the fracture in your case, and you are aged 70 years old, came into certain part on a curve, you are osteoporotic. If it came below this curve, you are not osteoporotic, right? So by this way, they are not using the machine now for everybody. They are using it for certain category of patients. Who are this category of patients who has to use the machine? The graph that you are going to use has 3 compartments. Upper compartment, middle compartment, lower compartment. After you get your probability of fracture in 10 years against your age, and you put the point in the graph. This point can be above in the first third, or in the middle third, or in the lower third. If you fail in the upper third, you are osteoporotic and you will take treatment. If the point fail in the lower third, you are not osteoporotic, you are normal, you will not be given treatment for osteoporosis. If it fail in the middle zone, you need to do DEXA study. These people, we take them and do DEXA. We take them to the DEXA machine and check their bone mineral density. Okay, how can you do this? This program is called the FRAX. F-R-A-X. It's available on the internet. You can go and write FRAX. You will go to the website of the FRAX. You will feed the information according to your state. As I mentioned, your age, sex, alcohol, steroids, whatever it is. And then you calculate the 10 years probability of the fracture for yourself. Then you will go to down in the same page. You will find the graph already there. You will put the probability of the fracture on the vertical line and your age on the horizontal line, or vice versa, and then you make a point. This point will come into a graph. The upper part of it is red, the lower part is green, and the middle part is orange. If you are in the red, you will take treatment immediately without doing the test. If you are in the green, you will not take treatment. If you are in the orange side, you will go for DEXA. You can do it by yourself at home, or the physician, as we normally do for our patients. We are doing it in the office, using the same program, feeding your information and getting the result. Now, we mentioned to you how we diagnose osteoporosis. How we treat osteoporosis then? Treatment of osteoporosis, there is medical treatment and there is lifestyle changes. It's known that if you walk, normal walking, and especially climbing stairs, since you are carrying your weight, you are stimulating your bone to build bones. And it's known that the person loses 5% of his bone mass approximately daily if he stays on bed. So by doing nothing, you are losing your bone. But by walking, you are building, or at least keeping your bone mass. Climbing stairs, you are putting more weight during climbing, so you are keeping bone mass. And resistance exercise like weightlifting and resistance exercises help you to build more bone mass. The second thing is vitamin D. Vitamin D is very vital, and the calcium, for the state of osteoporosis and also for the state of osteomalacia. And I am not going to speak in details about vitamin D, but we have active forms of vitamin D and inactive forms of vitamin D. Both of them are okay, but the problem is patients need normal kidney function in order to make the inactive form of vitamin D to become active form. If the kidney function of the patient is not normal, or if the patient have kidney failure or renal impairment, the non-active form will not be suitable for him. That's why we give them the active form. This active form is then transformed in the body to vitamin D hormone, which is the hormone that brings effect from the vitamin D. Sometimes we give the patient the combination. We give them the active form and the inactive form in severe cases, because the active form brings effect very fast and the inactive form needs time to become activated. So we give the active form to get faster result and the inactive form to replenish the stores. Calcium is important, and the daily requirement of calcium is at least 1,000 to 1,200 milligrams per day. And for vitamin D, we usually give 50,000 international units from the vitamin D, the inactive form, every week for 6 weeks, then once per month after that. These are routine. The most important treatment for osteoporosis is another treatment which we call bisphosphonates. This treatment stimulates the cells in the bone that forms the bone to be active, and the cells which are responsible for eating the bone to become inactive. So the active cells start to act and to build the bone, while the cells that kills or that eat the bone becomes inactive. It gives a chance for the bone to build again. We have two forms of this anti-osteoporosis treatment. There is oral form that can be given every week, and there is intravenous form that can be given once per year. Last thing here is patients who already got fractures. Patients who already got fractures are at a very bad state, because the most common fracture is hip fracture, and hip fracture is a serious problem. Why? Because 25% of the patients who get hip fracture die within the first year after the fracture. 25% will be in the nursing homes because they will not be able to walk again. And big number of people can walk with help. So it's a dreadful cancer with very bad consequences. So patients who develop fracture, whether it's hip fracture or fracture at the wrist joint, or fracture anywhere in the ribs, for example, this patient should take treatment for osteoporosis aggressively. But sometimes this patient do a very successful operation, but the physician, because they are surgeons, they forget to give patients treatment for osteoporosis, and patient discharge home without taking the treatment for osteoporosis. If this patient fell down again, he will get another fracture, and the second fracture most of the time is more worse than the first fracture. So in this case, patients who get fracture should be referred to geriatrician, because geriatricians are the one who are going to prescribe the treatment for osteoporosis for such patients. Internationally, this is the international routine that in any elderly patients admitted with fracture, he should be referred for geriatrician to take treatment for osteoporosis. And this information is for the community. If you have a grandfather or grandmother who got fracture, you have to get sure that she received treatment for osteoporosis at time of discharge to avoid the second fracture. And in the same time, this patient should be assessed for prevention of fall, because most of the time the fracture occurred due to fall, even if it is mild fall, like fall while sitting down. It can cause fracture spine, or mild slip on the floor can cause fracture hip. So the reason for the fracture should be searched thoroughly to know why the patient fell down, to avoid the happening of a next fracture. Thank you so much. I hope the information was informative to you, and if you need more information about diseases in the elderly, you can visit the website forgetmenot.com.